Ministry of Health is developing and rolling out digital health tools with the premise of providing digital job aids to different health workers in the different theaters of actions in which we work. That could be the community, that could be in health facilities, that could be at border points of entry where we do some health screening, and in other places where maybe we could be involved in some surveillance efforts.
We had a workforce of village health team of 1,450 people who were ready and were working with us. And so far we have given out the phones with the apps to assist in the digital transformation to the 1,450 VHTs.
Kenya is very lucky because the current government has community health or primary health strengthening as the vision. Kisumu was extremely lucky because the governor's first manifesto talking about strengthening of primary health from the beginning, and that is where it started from. So it is the leadership that drives all these other things that we are talking about.
When we used to do the paperwork, sometimes maybe the papers, they have disappeared, you don't know where you placed them. But this one is documented. The information is safe. What I have is safe. I can keep track of what I did in the past.
EHS has really helped us by doing our everyday supervision, because on back end in our tablets we are able to see which CHP has gone to the field today and what the CHP has done, even when you cannot do the one-on-one supervision, you can supervise through the phone.
Libo wabanga oyagala ofunye oba omukyala w'olubuto ng'olina okugendanga buli kaseera okumanya ebimufaako, watambulanga n'ogendayo, naye kati osobola okukozesa essimu yo n'omukubirako. Ne bwe yabanga mwana ng'oba mulwadde, wagendangayo okumanya omwana ali atya, naye kati osobola okukubira ku muzadde n'obanga osobola okukozesa essimu yo.
It is helping us to do mentorships based on what is exactly happening in the reporting. Because with this system, you are able to know that so and so is not reporting. So we tailor our intervention to reach out to such a person instantly as a district. Meaning that even at facility level, we are not just looking at the data itself, but we are using this data to make decisions.
To ensure that the digital health tools are easy to use for the providers who are using the tools. And I'll take, for example, like EHS system that we're using in Kenya, which is easy to use by the CHPs, and they're able to give services at the household level.
So we looked at speed vis-a-vis interoperability, and the interoperability structures are now known worldwide. Like for health, we are talking about FHIR standard, HL7 standards. So build a system from the beginning that can be able to interoperate into the future.
With the current developments that we are doing, we are trying to put ease of use at the core, so that the curve towards onboarding is not a very challenging one.
To think about integration rather than fragmentation. And what I mean by that is that in Kenya, for example, we have the ECHIS, the Electronic Community Health Information System, used by all community health workers across the country, with the intention that that data should be aggregated at national level.
Focus on simplicity and value. Simplicity of the technology used and solution developed will make it easy to adopt and maintain.
Really focus on the 1 to 2 key things that will make the difference for the users and for your partners in general. It has to be cost efficient, obviously, because that's what will drive success and achieving scale. But if you don't start with the key value, it will be really difficult.
La durabilité de ces outils, comme le e-santé.com, je dirais que d'abord, il serait très important d'assurer un très bon suivi technique de ces outils pour éviter les pannes prolongées. Ensuite, d'améliorer les sources de charge des téléphones, car la majeure partie des pannes signalées sont liées au circuit de charge.